Que es lo que hay, mi gente? We're here at a Day in Miami podcast.
Bro, you gotta stop hitting that pen.
I was going to say, hey, Day, bro. So it's Day in Miami.
Listen, I'm going to straight up just tell you. Who's the doctor? Who's the doctor?
Who's the doctor?
Who's the doctor? I see it in your comments. People always asking you about it. It's usually the chicks.
If you see it in your comments, you should see my DMs every time I post a video with this guy. They're always coming after him, Papa. Oye, who's that doctor? Mama, deja la enfermedad. He's married. He's happily fucking married. And his woman is also tremendo tronco mujer. If she catches you, deja. I'm telling you, his wife is a beast.
Is she also a doctor?
She's a trainer. She's, in my opinion, the best trainer in Miami. She's built herself from starting out doing basically just training. Now she's won some shows. She's been a competitor for 10 years, and now she has just a tremendous clientele of clients, and they stay. And she's so knowledgeable. She's more knowledgeable than me in a lot of areas of training and nutrition.
You're the first person to come on here and talk about somebody else before yourself. That your wife is very nice, man.
Yeah, well, it's true.
That doesn't
for those people who don't know you, Raymond, tell us a little bit about who you are and what you represent.
So my name is Raymond Ruszkowski. I'm a chiropractic physician. I'm partners at Family Medical Group. We are a series of medical centers in Dade and Broward County. We serve all types of patients. We're a primary care facility. We also do accident injury rehabilitation, physical therapy, obviously chiropractic services. But we are an up-and-coming medical center complex where we are in Dade and Broward, and we brand ourselves pretty strong. And we pride ourselves on being a concierge type of medical center where you can call us up and come in and get an appointment the same day. And whether you have a cold or if you're sick or if you need a checkup or like an annual checkup or if you need an EKG, if you've hurt yourself playing sports or weightlifting, you can call us up.
Encompass everything.
We encompass everything.
I can attest.
That's amazing.
To about half of the things he said because I've personally gone in for treatment there. Number one, obviously, I work with FMG. So I've learned a lot about them. And given that I used to be in the health insurance business before all of this, I understand it in depth. The best thing about this place, without a doubt, and that's what we try to push the most, is that it's literally a one-stop shop for just about everything. One of the things that we hate the most, and that's what, I reiterate in all the videos, is my worst nightmare about going to the doctor. Number one, now you typically you have an appointment 2-3 weeks out. Then when you get there, it's to get a referral to a specialist. That's another 3 weeks out. And then when you get to that specialist, it's to get referred to a lab.
To a second opinion or something.
And to do diagnostics over here. And FMG not only does it all in one place, but they have how many locations?
12, soon to be 13. And we also offer specialty services like you referred to, orthopedic, pain management, neurology.
So I've also, what I was getting at is that I do PT for a shoulder because I heard it weightlifting. I have an impingement from bench pressing porque soy un fuertote. And I went to Ray, and Ray, I figured out fast. He mentioned that he has a history in bodybuilding. And right now is when I learned, when we were talking earlier, that he was a fucking strength and conditioning coach at
he looks like it.
At UM. Yeah, he looks like a beast.
He looks like a beast. And so you know that Caballo proclaims he's the strongest comedian on the face of the earth. Do any of your services have anything to do with that? Any of the, Trembolone, any type of services like that are...
Well, as a result, my services are as a result of me doing that. Yeah, I had to. That's when me pingué todo, fucking weightlifting, and then I had to go see Ray.
Because I've been doing testosterone for a while, and I do NAD, and I do NAD twice a week, and it's like phenomenal, man.
You might have to crank it up a little.
My question would be:
I just want to be healthy. I want to be athletic. I don't want to be like that.
You want to look good naked and be healthy.
Yeah,
right?
I want to be
long time.
athletic, man.
How are you doing it? Though will be the question I would ask you in terms of, if you don't mind divulging, because I could tell you what the latest and greatest kind of bro science knowledge is on that in terms of the clinical application of being on TRT. Whether your testosterone was just a little bit low or very low, there still is really the right way is to microdose.
Yeah, that's what I'm doing.
Okay. Yeah. So it used to be you take 1 ml a week. the science has gotten away from that. Microdose keep your plasma serum levels like this, kind of like insulin. You don't want spikes and valleys, right? So if you're microdosing, are you taking a blocker, or are you taking anything else, or besides that? Or if you are, be careful.
So I usually do like weekly. I'll do an IV. I'll do 2 things of NAD, 2 shots, and then I also do something that they give me to put in the belly. What is it? The ACG, and then I do at the lab. I get the test.
So let me talk about that and try not to laugh. HCG is okay, but HCG really is only for men, 2 reasons when you're talking about taking steroids. And we're not talking about taking steroids. We're talking about taking gear, like 1,000 milligrams a week. We're talking about 125, 150 a week to maintain good levels.
Yeah, that's what I do. I usually maintain like an 800, 900.
Yeah. If you're taking HCG, it's usually for 2 reasons. Usually it's for men who want the appearance of a larger scrotum because they've taken so much gear that it's kind of shrunk. Or if you want more volume upon completion. Okay. So if you want those 2 things, great. But if you're young and healthy.
Completion doesn't bust a nut?
Well, okay.
Yeah.
So
you just made sense for everything right now.
So ejaculatory volume would be the proper term. So if you want those 2 things, great, take it. But if you don't, or if you're trying to have kids and you need it, take it. But if you don't,
that's where I'm at right now. So
okay. Well, that's
me off.
Okay. There's the difference.
Yeah.
The blocker, Arimidex or tamoxifen, is for men who go from the testosterone metabolizes to estrogen. And if you aromatase to estrogen more than, say, me or him, you might need a blocker to prevent gynecomastia or tenderness in your chest area. But if you don't aromatize quickly, you don't have to take the blocker because there are some cardiovascular side effects of that. So I would encourage you to look into that.
Bro, it's so complex.
Hey, I hadn't heard about the microdosing. So, because again, the bro science was, once you start injecting yourself, you stop producing it. So that's why you got to get...
true.
Okay.
But if you microdose, you stop that spike and valley. And so I went 3 weeks without taking. I take 0.5 every 5 days. And it's been great for me. Vitality, sleep.
You do yourself too?
Well, my wife.
Okay.
But I have not been training a lot because I've been out of balance building our center so much. But I've been training lately, and it's been the gains, the muscle memories is great, right? We should talk about life balance a little bit later. But I microdose 0.5 every 5 days, and I just went 3 weeks without a shot, Marcos, and I didn't feel a huge drop off. Why? Because of the microdosing, because I'm not spiking and then valleying. I've been like this, and my body is still producing enough where if I suddenly stop, I don't crash.
But he makes a good point, because sometimes I'm too busy, I don't even go to the clinic. That's why I asked you if you do it yourself, because she's like, oh, just do it yourself. I was like, I can't do that.
You should do it at home.
But I don't feel up and downs,
That's perfect.
I don't feel up and down.
Well, that's what you're trying to, you're trying to stay as level as possible.
Yeah. Consistent.
Well, because the ups and downs are like what triggers certain shit.
And mood swings too.
Yeah.
Mood swings and
but I've always been pretty consistent with that,
Good.
But the NAD is a game changer, right?
Yeah, for sure.
Game changer. You feel super clean energy.
Mm-hmm.
What was that?
You feel very clear. Your mind.
What is that?
You make decisions super quick.
Neurotransmission for all body processes, muscle contraction, organs.
You're on point, bro.
It's great.
Details.
Yeah.
Neurotransmitter. It's impressive.
It really is.
And you put a little in your belly.
Is it like a peptide?
No, it's not a peptide. It's a neurotransmitter. So you put it into your body, and it helps you to, again, all your body processes, your mental acuity, the nerve impulses get where they got to go really well. Berberine is another topic we should talk about. Berberine is nature's metformin. Metformin is a diabetic drug. Okay.
Oh, that's the one you put me on. I've been taking that.
Berberine.
Yeah.
Berberine is.
I've been on it for like 3 weeks now.
It's a derivative of ginger root, and what it does is it lowers your insulin, even better than some pharmaceuticals do, and it's natural. So my wife lives by it. It helps keep your waist. Berberine. You can buy it on Amazon. And it's oral. Yeah, just oral. Yeah.
Oh, wow.
And you take it like before you're having a high carb meal. Take the berberine. It helps your body's insulin response be regulated. You don't get spikes. And as you may know now, cardiovascular disease, other diseases as well, Alzheimer's, mental disorders, are found to be caused by gut issues and intestinal issues, digestive issues. Yes, there's a serious link. So if you maintain your insulin levels, okay, your insulin sensitivity, pardon me, and get rid of refined sugars and overprocessed foods, and eat foods closest to their natural state as possible. Use supplements like berberine, vitamin D, zinc, vitamin C, all at the right dosages. You're going to be creating longevity, okay? And if you're weightlifting, if you're resistance training like you guys are, not only will you live longer, but you'll live longer independently. And living longer independently is where it's at. You don't want to be 85 years old and have an attendant, right?
Exactly.
So, resistance training, the research is irrefutable. You'll live longer. And there is a direct ratio, by the way, and I think I told you this when I saw you, between the circumference of your thighs and how long you'll live.
No.
Yeah, because it has to do with the percentage of lean muscle mass that you have. So you should be passing on to your family, your friends, your parents, get in the gym, start pounding weights safely, okay? Eccentric-based movements, which are focusing on when your muscle is elongated.
Wait. This is something that people need to know. You just told me that the circumference of your thigh could determine the longevity of your life?
Correct.
And why is that?
Again, it goes to the strength of your lower body. The biggest muscle groups in your body are your glute maximus, your quads, and your hams. The more lean muscle mass you have there, your body is saying we're holding on to it. You're going to be mobile longer because sedentary lifestyle causes obesity. It causes metabolic diseases. And the more lean muscle mass you have in that area, it's an indicator for how long you will live because you'll be able to be moving longer, moving stronger, and you have a higher percentage of lean muscle mass as opposed to a higher percentage of adipose tissue, which is fat.
That's incredible. I had no idea.
And to add to that, I've heard that it's just having legs like that is an indicator that you're more mobile. And when you're more mobile, by default, that means that you're around more people, which can add to being around people and having good relationships adds to all that.
So now we understand why the cyclists are out there. They gotta get that circumference.
Well, I mean, they're doing one thing right.
They're on that BC.
On that BC.
Okay, so I mean, I had a lot of questions here regarding some other stuff, but
sure.
I am a big fan of going to the chiropractor.
Mm-hmm.
I go once a week to get adjusted. I didn't do it before, but I went. I got in a bad car accident when I was younger. I got hit by a drunk driver, and I had to go to therapy. A total lost car. I was coming out of FIU, got hit on 142nd and Bird, whatever. Nothing crazy, but I did feel it, and I had to go to the chiropractor. And I remember feeling like, wow, this is actually makes me feel really good. Over time, I guess as we get older, my back would hurt when I slept.
Sure.
Because I sleep with my belly, so then my back is being pinched. I got a new sleep number bed, whatever now, that's been fixed. So I would wake up with a lot of lower back pain, and I'd feel something, okay? But I also know that people are concerned about going to chiropractors for other purposes. I saw a crazy video of a lady that supposedly died because the bone got with an artery or something like that. I wanted you to clear that up.
Sure.
How effective is it going to the chiropractor? How often should someone go to somebody like you guys to go get checked up? And are there any
risks
with doing it?
Before you go on, the story you're talking about is some chick. Those are the ones that they get those towels and go, wah, right? That's the one you're talking about.
There's other evidences of this happening, and I think the one he's referring to is a young lady who got adjusted her neck, and she may have had evidence of a pre-existing issue.
Correct.
It's incredibly safe to have your back adjusted, your middle back adjusted. When it comes to the neck, it's safe. But you have to eliminate any markers of anything that you should be concerned about. You should always perform certain tests to patients. The George's test, which is where you have the patient flex their head and tilt them back. And if they get dizzy or if they have any pain, you might want to shy away from performing cervical manipulation. But manipulation is not everything that a chiropractor does. Obviously, we perform therapies to aid and assist in the patient. There really is no risk if you have no comorbidities, which is things that would be contraindicating to getting adjusted. It's safe. I've been doing it 26 years now. I've never had an adverse event, but I also don't over adjust people. So when you asked about how often should somebody go, I believe my philosophy is you go when you need it. You don't go just to go. There's a lot of practitioners out there, which kind of does dispel the profession a little bit, where they'll have you come in 3 times a week or they'll put you on payment plans. I think that's egregiously terrible. I think you should come in when you need it, okay? I think that when a provider evaluates you and they find a fixation, adjust it. But don't just get adjusted just to get adjusted. A lot of people like the way it feels. Great. You should only get adjusted when you need it. So I would say if you're young and active, once a month. If you need it more because you're a weightlifter or an athlete, maybe twice a month. Maybe even more frequently if needed. But I think maintenance care is important because it is true. It's in science. It's in the books. If you get adjusted, it does allow your body's nervous system to function optimally, right? Because there are reasons why you can't get the nerves to transmit their impulses to joints and organs in your body, because the spine is a 33-second movable operation. Okay, sometimes the joints get fixated in certain ways, and all we're doing is applying enough movement and range of motion to free up those fixations and free up the openings where the nerves come out and go to your body. Okay.
Wow.
From your spine.
What is that noise that people hear when you hear that crack, that pop?
Sure.
What is that?
That's called a cavitation, and all that is a pressure gradient is created when a manipulation occurs. A high velocity, low amplitude adjustment causes a pressure gradient from high to low. So the intra-articular pressure in the spinal joints, when you apply that thrust, it releases air from a gradient of high to low. So the intra-articular pressure is higher than the ambient pressure, and when that happens, it's like a plane breaking the sound barrier. You just hear an acoustic cavitation is what it's called. It's not bone on bone. It's not grinding. It's not ligaments getting injured or cartilage getting compressed. Okay, that's all it is. If you crack your knuckles in your hand, you're going to be fine. It's just an audible release of air.
And when I heard before, when I was younger, they would say, "Don't crack your knuckles because your knuckles are going to get big." Is that something?
That's a fallacy. That's
yeah.
You mentioned your mattress, and I think that's a very underrated topic.
Yeah.
People don't invest in mattresses, and they spend
What do you
a
suggest?
quarter of their life. It's a personal thing. I've tried Tempur-Pedic. I've tried Sealy Posturepedic. I like the pillow top. I don't like so much the Tempur-Pedic, not because it's not good. It's just not for me. Sometimes it makes people retain heat more. You have a Sleep Number bed, right? You like it, right?
I got it for my birthday because I was getting back pain. But now each section adjusts as I like. And I have an app, and it tells me how I slept that night. It measures my heartbeat and everything. So I get like a report the next morning. You slept like this.
Really?
So, yeah, amazing. Game changer.
And now I think my question was, what do you suggest, firm versus?
I think it depends on you. Man.
I think it depends on,
yeah.
But I will tell you this: if you're not getting 7.5 hours of sleep a night, and I don't, but I function differently, you're doing it wrong. There is a lot of evidence to suggest that if you're not getting 7.5 to 8 hours of sleep, you're taking years off your life. In fact, I believe it was Gary Brecka. I don't know if you know who he is, but he's a science guy, and he was saying that there is 0% chance that if you don't get 7 hours of sleep a night, that you are going to live longer than somebody who does. So I don't. I get about 4.5 to 5, but I have the kind of a weird constitution.
So you have a question.
Tiger blood, but
So when I was younger, I've always been a person that wakes up early, and I like to have that like immediate impulse. I just wake up like boom, ready to go, right?
Yep.
When I was younger, I read a book about sleeping, and it was very simple. It said if you want to sleep good, okay, no light. So then I had blackout curtains, right? Nice temperature air,
cool,
right? Like cool, like where you're in the middle, and no sound. Believe it or not, the air vent makes sound at night. So you would put earplugs in, right?
Oh, yeah.
Brother, you can sleep 5 or 6 hours and you wake up like a baby.
Yes.
And you slept like 10 hours. Then there's the adverse effect, right? That I've seen other people, a lot of my friends, I don't understand how people struggle with sleep. I don't understand that because I fall asleep like easy. That they sleep for 8 to 10, 12 hours and they will wake up still tired. Can you explain do you even know about that? Why is that happen? Or
I would say that it has to do with downregulation of natural hormones. You have a constitution where you can get a few less hours of sleep and you're fine, you're great. Anxiety plays a role in people's inability to sleep, and that would be a topic to get onto because it affects a lot of people, especially in today's day and age. A lot of young men are
worried about everything.
Worried about everything. A lot of young men are facing a lot of anxiety, and they shouldn't. I think we're going to hopefully get back to building stronger men if we can, because we need it, because we know the women are also very strong right now too. So my point is that anxiety is something that really keeps people from getting good quality sleep, right? So if you can reduce your anxiety and stress levels by working on mechanisms in your daily life, by creating balance in certain ways, then you get a better quality sleep. You mentioned some really important things: eliminating blue light 30 minutes or an hour before sleep, making sure your temperature is cool, and avoiding caffeine after 5 o'clock at night. I'm not a real big supplement guy for sleep, like melatonin and stuff like that. I don't really do that.
No, I'm on my whole. I do every night. I mean, it's helped now that I've been on it consistently for about a month and a half. But I do the glycine. I do
magnesium is one I would for sure.
Glycine. It's like one of the magnesium.
Magnesium glycinate.
I do that. I do inositol,
Mm-hmm.
and then I do this like chocolate. The rise powder. You've ever heard of that? That it comes with theanine. It comes with more magnesium. I do that every night, and I get if it's a good night with 6 hours.
That's a good
What,
complex.
'cause you struggle with sleeping?
Baba, I don't sleep more than 4 to 5
Wow.
at all.
Bro, the best way to go to sleep, you gotta,
But I do all that.
When you work out?
Dark ass room, it's 65 degrees.
Yeah.
Trust me.
But that, what you just said, is huge. Working out.
Yeah.
Consistent.
Working out and a little bit of sex before, you sleep like a baby, bro.
Ay, yo me rajo baja before going to sleep all the time, dog. Doesn't work.
Damn, bro.
Doesn't work for rookies.
You're like those memes that I see, bro. It's like 3 in the morning.
That's for beginners, bro.
Yeah, I've never had a problem with sleep, and I have a lot of friends. I think it's because of anxiety, though.
Well, the
Don't
thing,
think things, you know.
the thing about anxiety is it's simple. If you have anxiety, some people don't know they have it. Some people do. Okay. Some people are prescribed medications like benzodiazepines, Xanax, lorazepam, clonazepam. Okay. They're very dangerous. You're only supposed to take them for a short period. Some of my patients have been on it for years. Problem with that is that when you're on it for too long, your brain has receptors called GABA receptors. Okay. Your body produces GABA. Your GABA goes to the GABA receptors. It calms you down. Well, guess what? The benzodiazepines have a stronger affinity for those receptors than your body's own GABA. So after a while, it outcompetes your GABA for those receptors. And when you come off it too fast, you crash. If you're on it for too long, you go through what's called interdosal withdrawal, which means that you are taking the same dose, but your body needs more of the same amount to get the same effect. So people are freaking out going through rebound anxiety while they're still taking the medication. They don't know what's going on.
Doctor, bro, you sound like fucking ChatGPT, man. He's amazing, bro. You're amazing. How many people, do you guys get people that struggle with anxiety going to your place? Is that something you can help with?
Yes. Yes. And I have a very short analogy that the audience might take away from. Very short. If you're in the forest and you see a 12-foot grizzly bear, what happens to your body? What does your body do without you even having a choice? Fight or flight, sympathetic division, nervous system. Your pupils dilate, your hair stands up, your heart races, the ejection volume is longer and stronger. The blood is shunted to your muscles and out of your organs so that you can escape to survive. So those reactions are necessary for you to survive, right? But what happens when there's no bear and those reactions just hit you because of a dump of adrenaline or some other reason that is inherent to your body, or maybe you're just overthinking. When there's no bear, but you get those reactions, people don't understand you're not going to die. It's not going to kill you. You need it to survive. But why is it happening? So if you get to the bottom of why it could be happening without over-medicating, you can manage your anxiety. And there are certain techniques that are non-medicinal that can work.
Well, meditation helped me with that. I had a huge anxiety problem when I was younger.
Sure.
And meditation helped me with that. That's the most. I always had that pit on my stomach.
You're gaining control of your thought process. You're not ruminating over things that you shouldn't be doing. Great technique.
Which causes, what I realize is that it's exactly that. When you're more present and worried about what the fuck is in front of you, instead of the worrying, because anxiety is just you're worrying about shit that hasn't happened.
Yeah.
And the worst part is the psychosomatic responses. So you're ruminating, you're having anxiety, and you're worrying. But guess what? You're getting physiological responses from that are not always good. That can be bad. Cortisol levels spike. Cortisol is a catabolic hormone, right? So when you go to sleep at night after you've worked out, you should be taking some kind of protein, usually in the form of casein, because your body will let it sit in the stomach and your body will pick at it all night long, as opposed to whey, which is out of your body in 45 minutes, right? So you'll stay in an anabolic environment. So you wake up with the pump that you earned. But if you're in a catabolic environment and your cortisol levels are high, you're degrading muscle, you're adding body fat by doing that. So that's why reducing anxiety can also help you build lean muscle mass, and you'll be better with your workouts. So if you can master that technique of mind control and not ruminating over things that you really can't control, and taking control of your life by working out and eating right and having a positive attitude, it goes a long way.
Yeah, I mean, that's usually how I live. I really don't care about it. I always just have to figure it out, I don't really stress things out.
That's the kind of attitude that I wish could become more contagious.
I got my wife there, it hasn't even happened yet, and there's like a small chance of happening, freaking out about something.
Yeah.
And I'm like, this hasn't happened yet, and it's not going to happen. And the likelihood of it does happen, I'll figure it out once I am presented with that problem. I'm not worrying about something,
That's what it'll be, bro. On to the next.
Correct.
What's in front of you, bro.
Yeah, and that type of attitude, I think, as an entrepreneur, as anybody, man, you need to really take that on. I think people say, "Oh, un vaso agua."
You got to be able to take hits both in life and in business,
and roll with the punches,
and keep going. Yeah.
If you don't roll with the punches, you're gonna be stressing everything out. Oh my god, this! Oh my god.
Learn from it too. You got to learn from it. We're talking about burgers next. Is that what you want to talk about?
We can talk about whatever you want, man. I mean, I just have my questions here. You know, I can keep it rolling. I'm just looking at here.
What do you mean burgers?
Well, who's got the best burger in Miami? I got my spot.
You have your people?
Got my peeps.
Damn.
Oh,
I don't think I've ever asked. I don't think I've ever asked who has the best burgers in Miami, bro. Doc, you're a protein guy.
Yeah.
Work out. You're
Yeah.
healthy.
Yeah.
What's your top 3 burger spots in the city? Give me your top. Starting with number 3.
Number 3 is going to be Apocalypse Barbecue.
Ooh. The Lala's Burger or Apocalypse?
No, just the classic one.
The
Just
classic.
yeah, it's great.
He just opened a new spot now where
Yeah.
my house used to be.
I was gonna go as my number one, Lala's.
Damn. I haven't tried it
It's
yet.
good. I'm more of a traditionalist when it comes to burger. So I would say that they're number 3, and then
So number 3 is Apocalypse. Number 2.
Skinny Louie for me is pretty consistent. We go from Cutler Bay there for burgers. My son loves
What do
it.
you like about it?
I'm sorry, Cutler Bay. There's a
Yeah.
Skinny Louie in Cutler
No,
Bay.
we drive from Cutler Bay to Skinny Louie Wynwood.
No, but they're opening one in South Miami and they're opening here in Coral Gables.
That's great.
Nice.
They're expanding quickly.
Their consistency,
Never been though. Crazy.
consistency, and
Fire. I can tell by looking at those
You can
sticks.
tell, yeah.
their beef is great, and their consistency is great. And it's
Nothing
just,
like this smash burger.
there's nothing like it, to be honest with you.
Facts.
Because Capital Grill just opened up Capital Burger in Gables, and we tried it, and
Yeah,
it was
okay.
okay.
For a while.
We went
okay.
there once, never again, bro.
You know.
Sorry.
But Babe's Meat and Counter number 1 for me. The consistency, the no ketchup, nothing, just pickles. They're special little clean, special little sauce, great bun. Yeah,
Yeah.
couple of those, I'm good.
Oh, and you?
Well, like I said, I think Lala's is my favorite. If you ever been to TCB, the food truck right off of Bird, I like that. It's like I'm a smash burger guy. Would you say that Lala's is smash?
I haven't tried it yet, man. I mean, I've seen Between Two Buns with JP. I've been there. It's super good too. And I had there's another guy called Ricky something by
If you want to be fancy as fuck, Hillstone's Burger is off the chain.
No, you know who I gotta give a shout out to? Break Burgers.
Break-
They were at
I've
the
had
Coconut Grove Arts Festival. They were there and they came and pulled through for a 305 festival. Phenomenal.
Good.
Well,
And that's the same people from the taco spot. What is it? That little taco spot that's all over the place now. Tiago's Tacos.
Have you
Phenomenal.
tried Cowie Burger before?
I haven't tried Cali Burger either.
And La Birria is right down the street from Skinny Louie's. It's okay. It was okay. It was all right.
And I mean, I love burgers, man. And from the fast food places, what's your top burger from the fast food spots? Or Wendy's?
I gotta tell you right now. Five Guys has been on something else right lately. They've been really good.
Yeah.
Yeah.
What do you think about people suggesting don't eat at these fast food places, like with the seed oils and all those type of things? Like, what's your opinion on that?
My opinion is solid in terms of seed oils. Is stay away if you can. Okay, coconut oil is the best in my opinion. Avocado oil.
But most people say that they cook with seed oils, no? Like there was a whole campaign. Yeah, there was a whole campaign against Carbone and
when
New York
they-
saying they're cooking with seed
Oh,
oil.
in restaurants?
rigatoni and stuff. Yeah, so I was like, oh yeah, how bad is this really?
It's
it has a
better.
higher cooking point. That's what
It does.
Really do that.
We use beef tallow. I mean, my wife cooks with beef tallow.
But that's another thing that I started hearing.
yeah.
No, I don't want to sound like an idiot. For the first time ever, after RFK started running, and and I hear about beef tallow all of a sudden on Thanksgiving post that he's cooking it. I have no idea what beef tallow is.
Grease from the
It's fat. Yeah, it's fat rendered from
You
natural
can't buy it
beef.
at stores, can you?
Of course you can.
bro.
Oh,
Yeah.
I've never
Yeah,
seen
you can.
that. Like
It's
it's
not
not
the
in the
cheap-
oil.
It's not that
No, you can.
but
If it's not grass-fed butter, it's beef tallow for what we're cooking with. Kerrygold grass-fed butters.
But they sell it like at Publix and stuff.
Yeah. You can order it from wherever you Sprouts. We get a lot of food from Sprouts. Sprouts is good. In fact, Sprouts has uncooked chicken wings that you just put them in the air fryer for about 25 minutes, and whatever sauce you want to use, they have a lot of flavors. They're
Banging.
really good, really good, man.
There's a fast food restaurant that recently switched everything over to beef tallow. It's Steak and Shake. No,
I think it is Steak and Shake.
Steak and Shake just recently switched everything over to beef.
I've never been there. I got to try it then.
They have this.
Try not to do that much, but
Yeah, I was gonna also say like you could do all that bullshit you're talking about if it's 10% of your diet.
if you have 37 meals during the week, 34 of them better be pretty clean.
Yeah.
If you have goals.
Of course.
Yep.
No, but I'm saying like the seed oils being detrimental, like the people being worried that oh my god they're gonna kill you. If it's 10 to 15% of your diet,
No, that's okay.
yeah, like I don't.
I mean, Chick-fil-A's chicken sandwich has 50 ingredients in it. 50.
I'm not a big fan of that, but that's fucking crazy, man.
That's nuts,
fucking
right?
crazy.
50 ingredients.
That's crazy. What do you
That's
think?
just
But listen, this guy RFK came in, okay, and I haven't seen him do anything. I haven't even seen him be in front of the camera. Like, are you that you're more in that world? Maybe have you seen things move along differently, or where do you think the direction of the States' health should go to?
Well, I believe that he has the right idea. Okay, obviously he came in; it's pretty controversial.
But I don't think it's controversial.
No,
I think it's a common
you want to make America healthy. You have to eliminate certain things that the FDA has been saying is okay. For instance, FDA has cereals that are more nutritious than eggs. Imagine that, right?
Yeah.
I think he has the right idea. I don't know where he stands on vaccines. I am not somebody who wants to get into that topic because I know it's controversial. But the COVID situation is one that, that's been very controversial with the vaccine for COVID because it's not really a vaccine; it's a prophylactic treatment. But in any event, I think he's trying to find a link between vaccines and childhood autism, which the research should be done on that. I mean, they should really dig go in, dig in, see it. Because they were saying, we don't got to worry about it before, right?
But I think their thing is that, like, even if it does, and it affects 10% of the population, whatever, we're still getting that 90% that are getting, preventative care, because
of course,
whatever the case is. I think that's the only thing that they're going to lean on.
If a vaccine is sterilizing, which means they inject a attenuated or like a very small amount that's barely alive into your body, and it makes your body make antibodies to prevent you from getting polio or smallpox, all for it, 100%. Gotcha. But if it's not that kind of vaccine, that's where we should have discussion. And remember, science is about discussion, questions, and answers. The minute you stop asking questions in science, it's no longer science. It's just propaganda or a directive.
Yeah. And listen, the vaccines aside, because, again, that is a touchy subject. But, number one, he got rid of the red dye.
Yes, that was a huge.
Number one. Number two, just before jumping on this podcast, I read that he's trying to pass something to improve baby formula.
Mm-hmm. Yep.
So that they're not putting additives
like aluminum
to baby formula.
Yeah.
I mean, that alone.
My question has always been, why can't we mimic what they do in Europe, right?
Yeah.
The food in Europe, they have the same brands in Europe and the United States. Yep. And the ingredients in the European versions versus the United States versions.
Have you ever seen that?
Yeah. It's insane.
Have you ever seen the cereals next to each other?
Crazy. Yeah, I see all over social media.
But it's the food lab.
Yeah, and I notice it too when I go to Colombia. I travel there often. You eat over there, and I feel lighter and stuff. Here is you feel different. I think we're just accustomed to it. But it's very even the color of the eggs is different. I've seen eggs that are blue.
No, we buy others. Yeah, blue. That's the ones we have now.
Yeah,
and the yolks are orange, like a dark orange.
You want to be scared? I've talked to a dude that's in the agriculture business, and he says that they can manipulate
the color
of the eggs with the diet.
Yeah.
So fuck your color. Like, that doesn't even mean much nowadays. You know what I'm saying? Oh, look at my yolk. It's so beautiful. And you can manipulate it through the diet you feed the chicken.
That's crazy, man. Listen, earlier we talked about life balance. We said I wanted to get your opinion on that. Obviously, we're in Miami. Everybody works a lot. Some people got 2 jobs. You gotta be a hustler in this city, man.
Oh yeah.
This is like the new New York. If you can make it here, I think you can make it anywhere, right? This place is blowing up. A lot of opportunity comes with that. There's the same way, a lot of stress and everything else goes up. But I feel like I have a good work-life balance. I want to talk to you about life balance and how important is that. What do you suggest?
It's critical. I mean, a life balance will give you, kind of clarity in where you're going to be 20, 30 years from now. What I mean by that is that if you can create balance, and let me just say, I'm out of balance often, but because I'm driven. And, sacrifices sometimes have to be made. Yeah. My family's taking a hit with my time because I'm busy. I'm investing a lot into our business. But I think they see the light at the end of the tunnel now, right? So I would say that relationships, your spouse, your kids, so important.
Yeah.
Marcos, you have like 7 children, right?
Yeah.
In Florida, only 3.
But your relationships are very important. Your exercise, your food intake, your mental health, your sleep habits, all that stuff. If you can try to be as in balance as you can, it's so easy to get out of balance.
It is.
So easy to be stressed and, I'm just going to have, this food item or that I shouldn't have because I just feel I want that emotional eating. It happens to a lot of people. Or, I'm going to put this off. Really, that balance is so hard. And again, I'm not trying to be hypocritical because I'm out of balance a lot, but I'm also hustling a lot. And it's hard to maintain it. If you can find that balance and you can put it in a bottle and sell it, I think you become pretty wealthy You know what I mean? But it's different for everybody. Everybody has a different circumstance in their family, in their business,
Do you
their
see a lot of
job.
people that are like that when they come to you guys, or what's the typical patient that you guys are seeing, and what are they usually struggling with?
So we see a lot of, I see a lot of injury-based
Yeah.
patients, right? But it's amazing how often we get into discussions about family life or anxiety, nutrition,
Because they open up to you.
fitness. They open up because my job is as a healer, as a provider and practitioner, is to listen first. So many providers don't listen to give them eye contact, listen, comment on what they're saying, ask follow-up questions, make them feel like that when they're sitting in front of you, that you're giving them your time. Because if you're not, what are they doing there?
Yeah.
They're coming with their time to sit in front of you to get advice or to get treatment for injuries or ailments or to get medication if you're sick or if you have a condition. And I think that gets lost. And that's something that we really pride ourselves on. We train our staff both in a customer service, patient-based manner, as well as being competent in the roles that they play. So patients open up. Once you give them that confidence, confianza with them, you can get them to tell you other aspects of their life that, oh, by the way, now you can focus on to make them whole as a person.
That's huge though, because in today's medical world, where it's very easy to feel not only like a number,
Sure.
Yeah.
right? But on top of that, hearing you say that, it makes sense that you would more than likely catch on to more things by these people opening up to you.
Yes.
Now you can pinpoint.
And I suggest, hey, go across the office and see our nurse practitioner. And,
Right.
maybe, we are a primary care facility. If you have a doctor and you're not happy, come over to see us. Yeah. And this is the kind of care you're going to receive.
Usually, you want to have you have to have a good relationship with your doctor. There's a lot of people who maybe go see a doctor once a year, twice a year, something. I think it's good to have a doctor that really understands who you are and knows you. Because you can maybe give him a call, talk to him like a friend.
It's funny on that part. I give my cell phone to everyone.
Yep.
I give it on my card. I put my number in your phone. Guess what? Nobody abuses it. Nobody calls me at inappropriate hours. Nobody sends me messages. If anybody sends me a message, it is strictly a question about their condition or if they have. It's amazing. You would think that giving your cell phone out would be a problem. It's not. I have not experienced any negative.
But you know what? That's something that's very important because that customer service, that touch directly between you and a doctor, that I can text you
that access,
access like that, wasn't known further before.
No.
And the people who do it now are the ones who are going to advance.
100%.
And a lot of people have the misconception that, like doctors are maybe like attorneys. If I text him, he's going to be charging me.
No.
Like that. The doctor wants to help you.
No.
Hey, come in, get checked out. That's not
Absolutely.
at all.
Yeah.
Manny does a very good job of that. He knows every doctor in Miami, and he hears me like, oh, I got you right now. I got you an appointment with Dr. X. Hey, your back's hurting. And I'm like, damn, but he really cares and moves around the community like that, And
it's important.
And you can catch things early.
We can.
Most men, what do they think? Oh, worry about it later. And then, you're fucked.
Yeah.
You didn't see the video we dropped with you didn't see the bedside manner he had with that cyclist?
I haven't seen that one. No.
There was a lot of contact there. Yeah.
Bro, that's when I dressed up with like a cyclist and he was.
I seen the one that you came in as a cyclist.
Yeah, that was the first one.
Yeah, I seen that.
You should peep it. You should play it over. You should overlay it over this combo.
Yeah.
Did you return the wheelchair, by the way?
I think I did see that one. You're leaving in the wheelchair.
No, but that was in the first video.
Oh.
I mean, I used it in the second video too, but you obviously didn't see the one we were just talking about.
No. I have something here I was going to say. There's.
Did you play sports? You play football, right?
Wait. I had these two questions here. Now I remember them now. A lot of people, I have a couple other, friends of mine that are doctors, etc., and they said that there's an underlying problem where people are getting overprescribed medicine. Do you see a lot of that, or
yes?
Like instead of saying eat a better diet, do this, do that, people are just load up on pills.
So mainstream medical advice has always been: here's the symptom, diagnose it, and then usually medicate it. With things like high blood pressure or diabetes, look, there's a certain demographic of people that have reversibility there, okay? You don't have to be on metformin. You don't have to be on beta blockers if you do this in your life. But you obviously have to be careful. And this is not medical advice en masse. This is talk to your doctor. Hey, I don't want to be on beta blockers. I don't want to be on metformin. If I go plant-based or if I exercise more or if I change this, can we wean off? Particularly the anti-anxiety medications that we referred to earlier. Yeah. And I usually encourage people to talk to the doctor about weaning off of these short-term medications.
Do most insurances cover that type of stuff or no?
Yeah, of course they do. One of the ones I see overprescribed all the time is statins for high cholesterol. And I don't know if you've been keeping up on the science with it, but high cholesterol really has been disproven in terms of what the numbers were saying, that if your cholesterol is, 280, 300, you're going to be okay. In fact, there's a guy that I have a lot of respect for, Dr. Ovadia. He wrote a book called Stay Off My Operating Table. He's performed about 20,000 cardiothoracic surgery procedures. And what he's finding is that the HDL LDL correlations was kind of like, again, off. It's not really a verifiable thing that if your LDL is super high, that it's a huge risk factor for a cardiovascular event. Same thing with your total cholesterol. Cholesterol is so necessary for hormone formation. And he's not seeing people that are getting heart attacks and cardiovascular events with super high cholesterol numbers. Sugar is the problem. Sugar scores the interior lining of your arteries, makes it more coarse. And then when the atherosclerotic plaque comes by or forms, it's because the fatty tissue and the plaque forms on the interior part of your artery because it can't smoothly go by because the sugar that we intake makes it rough. So it's sugar is the real culprit rather than, say, saturated fat.
Because again, I got another thing to add to that. They've also found out that the information we've been getting as far as what foods give us cholesterol is not the same too. Like meat, eggs, and butter, bro. That was
taboo. It's taboo. It's shunned
for the last.
And now that's all we eat.
My mom would tell me, "Hey, don't eat too many eggs. You're gonna get high cholesterol."
Yeah, bullshit.
That's all we eat now. It's carnivore-esque type. Imagine us back in the day when humans first came on board. What do we eat? We killed what we ate. We picked what we ate, right? So we eat red meat all the time, every day almost. Eggs every day. I went to the gym at 5 o'clock in the morning with my son, by the way, 17 years old. Got him in the gym pumping weights. Got to get him going, man. He's taller than me. So anyways, we came home and we made 12 eggs. 6 and 6, had some Greek yogurt, a little bit of raw honey, water, black coffee, boom, done. And that's it.
You know what example I always use? I don't understand how, that at one point in history, they can track when humans started eating meat.
Sugar?
No. They can track when we started eating meat. And from that point on, our brains developed 20%.
Oh, I've seen that.
It's DNA markers. What you're talking about. You're talking about it changes your DNA.
Yeah, and I also saw...
How can you hear that and say...
I also saw there was like a point in time, if you look back, that when we started like putting sugar into everything, obesity just like
skyrocketed.
Yeah, that's without doubt,
man.
Did you see pictures of like back in the 60s and 70s, like on the beach, everybody was thin and skinny,
it's
and
fucking crazy, man.
Ultra
sugar and everything,
ultra processed food, and it's also our accessibility to it.
Yeah. Oh yeah, the convenience factor.
The fact that you can go anywhere and you can pack 2,000 calories within a few things off a shelf.
You go to Starbucks and get a coffee.
Bueno, Uber Eats. Forget about it. Olvídate, because right now, that's, hey, just boom, 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 and the food's at your door.
100% right at your door for $10 more.
Super easy. So I see a lot of these little pop-up spots that are coming around. Get the quick IV, get the quick B12 shots, get your quick, adjustment in your neck and all over the city and stuff like that.
Wellness.
You're walking in, you're in there for 10, 15 minutes, and you're walking out. I don't know if that's good or bad. I've been to them. It feels like maybe there should be a little bit more, checking. I wanted to get your insight on how the landscape in the industry has changed towards that, and how everything is just, people just want quick stuff all the time. And is this actually going to be something good long term, or is it hurting the industry?
Never rush a good thing, which is your health. So if you go see one of those places, and I'm not knocking them because I don't really know them, Snap, Crackle, Pop, and the Joint, stuff like that, not knocking the business model. But I feel like great care and time needs to be taken for your full health history, okay? I don't know what markers you have. I got to do some films. If you want to get adjusted regularly, I got to see what your spine looks like. Depending on other symptomatology, you may need to do an MRI. To go in and just get out, the supplements, the IVs are great, right? You don't need them all the time. You can just get that in your diet. You should be taking, B-based vitamins in your food. You want to supplement, fine, but vitamin D every day, 5,000 IU. Vitamin C, 1,500 IU. Vitamin K with zinc together. Hey, there's another one we didn't talk. We talked about berberine, right? But Turmeric with black pepper.
Okay,
Okay.
I bought that too. I've
Yep.
been on that one too.
Turmeric with black
Berberine and
pepper.
turmeric is what he.
This is something that needs to be, you can cook with it. You can make it into a powder or paste. You can cook with it. It is so good for your immune system. And the black pepper is critical for blood movement.
I didn't know that. I do turmeric and ginger all the time. I take ginger shots all the time.
Take it with black pepper, the turmeric. Otherwise, you don't get the same efficacy. So the black pepper helps make sure your blood is moving through your vessels much better. And the turmeric is just it's a natural healing agent. So,
I'm panicked, and I hope that this video doesn't have to get played one day. I'm panicked at having a heart attack. I've seen so many friends of mine that had them, people older that passed away from it, and I'm like, bro, what can I don't want to die from a heart attack, bro. What can I do to avoid that?
You heard about the whole sauna statistics on heart attack?
that's outrageous. That's outrageous.
Bro, I go to the sauna all the time, though.
That's great. That's great.
All the time.
40%. If you do 20 minutes at least 3 to 4 times a week,
Longevity?
Yeah.
40%. That's
How about cold plunges?
I do the cold plunge probably like once a month, once every 2 months, you know.
Those are brutal.
Yeah, I just don't have access to one. You know, you want to go to Lifetime Fitness and pay $300.
No,
you know,
I go there and I still don't.
Coño, bro.
I do sauna.
I would say that
Sure, let me use your pass.
what you're doing now is good. I mean, you can't control the inevitable, right?
Yeah.
But you can do your best to mitigate. So the balance, the foods, sleep, rest, mental health, mental tranquility. One of the best, shortest advices I've ever seen was live with a calm heart. If you live with a calm heart, then you decrease the chances of being overstressed, cortisol, plaque formation, cardiovascular event. So I think that, living happy, being positive, being a generator of energy instead of an enervator, which is somebody who would kind of drain the energy from you. Walk around. I try to walk around as a generator, give off good energy, make everybody happy, open doors, smile. A smile can change somebody's day. Okay. Opening a door, being courteous. These kind of things are the traits I live by. And hopefully that's going to help me, with karma and with physiology, So I try to press that on people.
Doctor, honestly, this has been one of the more interesting conversations.
This guy's a good role model.
I can really hang out with you.
This guy's a good role model,
I think I
bro.
found a friend, bro. New friend, bro.
I can let loose now, so
Yeah.
whenever you want to,
Yeah,
go do it.
maybe we should hang out one day for Friday nights.
Hell yeah.
Doc, I know you're part of the team of Family Medical Group.
Yes.
Okay, what makes you guys so good? Why do people go to you? And tell me a little about the operation.
Well, as a managing partner, I have direct influence on patient care and everything that kind of encompasses that with my partner, Liz Rodriguez, who's the CEO of Family Medical. We've expanded to 12 centers now. We got 10 in Dade and Broward. We're going to be in West Palm Beach soon. And the reason why we've been able to do that is because we do deliver what I feel is a unique service to patients, giving them the proper time, attention that they need, giving them access when they need it. We provide all types of services that encompasses most of the population. So primary care, if you're ill, if you're sick, if you need a checkup, an annual for your insurance, if you're pregnant, you want to get a checkup, we have women's health, we have psychiatric health, we do allergy testing. We can find if you have an issue with allergy testing. We are now doing a lot of men's health, hormone replacement therapy. Obviously, if you've been injured, whether it's in sports or if it's been, unfortunately, in a car accident or a slip and fall, one of our specialties is rehabilitation of those kinds of injuries. And Marcos, you can attest, I know you've come in a few times. And so, we're kind of an all-encompassing medical center. Family Medical Group has grown from one center in Kendall, 13788, to now 12 centers. And we're looking to continue to expand because we do deliver a wonderful product.
Yeah, I know that you're an ambassador there.
No.
But you're also a patient.
A patient.
A patient. So tell me about your experience with them.
Again.
And listen, for those of you who know Caballo, know he's authentic, man. So he's not going to get paid. He can get paid. He won't say anything he doesn't want to say.
But it's no mistake. I have a partnership with Family Medical Group. But again, what I've noticed after working with them, and like I mentioned before, I did health insurance before this whole comedy thing. So I know where all the problems are in the medical game. I saw them firsthand. And when I started working with Family Medical Group is when I noticed that the most crucial part about their whole process is how, again, you go to a doctor right now, it's a nightmare, number one, to get an appointment.
Yeah.
Number two, you go to your primary, they have to refer you to a specialist another 2-3 weeks down the road. You get to the specialist, then they got to refer you to go do diagnostics over here and to go see another person over there. The best thing about this place is that it's a one-stop shop. And in addition to that, in addition to figuring that out just through the partnership, I happened to get injured weightlifting and I ended up doing PT with this animal right here. And then that's kind of when I figured out that like we figured out on this podcast, that homie's a walking
It does, bro. It
encyclopedia.
really does.
And he's again right here today, years old. When I found out that he's was a sports strength coach at UM, and again I got injured, and within 2 weeks I already started feeling the difference, and it's empirical data that I have here.
Yeah.
It's honestly one of the best clinics in terms of the way they handle their patients.
One of the things that you benefited, I know, so far from is our radial pulse wave therapy, which is a newer technology that even the NFL uses to get their players back to the field of play faster. It is an acoustic, it looks like a gun. You hold it. It has a compressor as part of the tower, and it fires a little bullet inside the cylinder of the gun at a very high frequency, depending on the injury to site, because the thicker the tissue, obviously you want to be more stronger. But it helps to do three things. It helps your body. It creates a little bit of controlled chaos. So it causes your body to produce collagen in the area where you're treating it. And collagen is a matrix that heals everything, right? It also causes a process called neovascularization, which is the formation of new blood vessels in the area, which brings a higher percentage of fresh oxygenated blood to the area. And also because of the strength of the acoustic pressure that's going into your body, it overwhelms the free nerve endings and it decreases your pain. So you're getting a lot of different things at once.
Another thing that he put me on there was that collagen. And now that it's been 2 months that I've been on it, that's a wonder drug. That's a wonder chemical.
That's wifey. Wifey did that. She's on collagen.
Powder every day,
or gel.
Sometimes at night I do it too. That has made me feel.
Collagen is on your diet? Like a typical diet?
If you're eating ligaments and tendons and tripe and stuff like that, which if you go to any Vietnamese restaurant and get some pho, you're going to get that.
Yeah.
But if you want powder or paste, just for your hair health, your hair follicles, your tendons, your ligaments, all the structures that your body produces and has to remember, our bodies regenerate every year. We're like regenerating every cell in our body. So if you influence it with some collagen matrix, your body can heal its soft tissues a little stronger. And as we age, we want to try to combat the effects of osteoarthritis and arthritic change. And this will help you do that.
No, since then I felt the most lubricated I've ever felt. I'm not.
It doesn't take much though, does it?
It does. I've been
like a little bit.
What?
No, I'm talking about the collagen.
The sick one? Yeah. Come over to the sick side. So for the record,
the double take.
I said lubrication, and then they go, it's a little one, right?
I was gonna ask you, have you heard of EMS training?
EMS
training, where they put these suits on and
yeah,
pulses going through your body as you're like doing calisthenics.
That will help prevent atrophy, but you're not going to get any hypertrophy, which is muscle growth from that. Okay, but it will. Maybe I've seen it with people putting it on their abs and stuff. Bruce Lee used to do that, but he used to do that when he was doing work and stuff like that. But I mean, there's no science behind it. We don't know for sure.
Not yet.
Yeah,
and it's great. I feel good after it, but I wanted to get your.
I mean, the muscles contract, but they're not under load, so you're not going to get any hypertrophy. But you'll prevent atrophy from doing.
Listen, I got sore in muscles I never even knew I had.
Isn't that equivalent to what we do with the?
Yeah, we do the metrical muscle.
25 minutes. Zoom.
Probably a bit higher.
A higher intensity, and you're doing calisthenics as your.
So you're adding that in too.
You're adding calisthenics. So you're doing push-ups, pull-ups, this, that, and they're just shocking you, boom, as you go.
By the way,
in waves.
You did tell me you did that.
Yeah. It's incredible. I felt good. And Justin did it too. He said it felt good. You feel sore for like 3 days.
One interesting topic regarding that is a lot of people think that they go to the gym, they're going to lift weights because they want to get bigger or stronger. But I believe that calisthenics that you just touched on, flexibility in calisthenics for people that are definitely, 30 and over, 35 and older, calisthenics-based training with resistance training, functional training, and training like you're an athlete is one of those things that's going to help you live longer instead of just going in and doing some bench press and some curls and stuff like that. Unilateral stationary training is kind of something that people need to put as the smaller component of their overall health and overall training package. So you should be doing things like sprint intervals. You should be doing things like calisthenics, box jumps, step ups, things that push your heart in a high intensity in a short duration, because steady state cardio has a place, right? But high intensity interval training is where you're going to burn the most fat, retain the most muscle, and get the best cardio benefit. So high intensity interval training is where I would say people should be at.
Yeah. I had one last question, just out of curiosity though. Pickleball.
Mm-hmm.
Have you played or no?
Super cute.
I know a lot of people that play. I've never touched a racket, but it's not because I'm disinterested. It's just at the time, it's crazy. So,
but I see it for whatever reason. A lot of people getting injured playing pickleball.
They're building a state. Didn't they build a stadium for it?
Yeah.
But there's a bunch of them.
Yeah, there is.
Oh, you mean an actual stadium?
Yeah, like an actual on Key Biscayne. I think they're building like a pickleball.
I saw that. Listen, it's a what from what I can tell on the outside, because I don't play that shit. It's only a good workout when you're playing ones.
That's true.
Singles.
That's true.
Because when you're doubles, that's just like racquetball for me.
Yeah.
When you're playing doubles and racquetball, once you get the angles down, you're really not moving. It's tuk, tuk, tuk.
Yeah. Well, yeah, you're right. You gotta ask my producer what my singles record is, bro.
You get schooled out here.
Yeah, just ask her on there, bro.
Bro, one of those times he got pickled there.
The singles record, bro. Singles record. 11-0. I went one day, bro. It was
Play.
I play at Tropical Park or I play at Fairgrounds. Yeah.
The tropical park.
Yeah, bro. But it's fun. 7 a.m. baby. 7 a.m. Early morning.
You like it though, right?
I love it.
Yeah.
I absolutely love it.
Get some
Honestly, I can
hell
play.
yeah.
I can play that thing all day long, bro. I'll be super happy, you know. And my sport of choice is always basketball, which I play on the weekends, Saturday, Sunday
It
morning.
was mine too, forever.
Love that.
Nothing like it. Nothing like when I first got to Miami, you would find pickup games at Sunnyland Park, and I'd go to Gould's and just drive around and find it's the best.
Yeah, that's the best thing, man. And you get a great workout, 3 hours.
Yep.
It's fun. So
Yep.
you're sweating and you're in.
Yep.
I had my watch on once, my iWatch, and I think I burned like 1,800 calories. Bro.
No, it's insane, and the agility and all that stuff's great.
Hour or two.
Yeah, that's best.
But
Sounds
it's been a pleasure, man. It's
Real
really
pleasure, my pleasure.
Very few people I know that are like in very articulate and extreme detail of their craft and their industry, and you can tell you really
Try
know
to
what
be.
you're talking about, man. That's impressive, man.
Thank you. Nice to meet you. Pleasure being here.
Thank you
Yeah.
so much, man. Obviously, with you, it's always a pleasure having you on.
See you soon, Baba.